In Sanford, city councilors recently voted to pause the syringe exchange program for 1 year. They say this pause is needed to address an overwhelming amount of needle waste. But public health officials are raising concerns as the state sees more infections from IV drug use, specifically HIV. News Center Maine's Alex Haskell spoke with leaders on the issue and explains.
There have been individuals with needle sticks from these that have gone to the emergency room.
Sanford City Manager Stephen Buck says over the past year, the city has spent nearly $200,000 collecting more than 40,000 discarded needles.
I believe that we all can reasonably recognize that those medical sharps being thrown on the ground or left wherever they were used is a public health safety hazard.
He says it's why the City Council recently approved a new memorandum of understanding which pauses the current syringe program's collection and distribution.
This is yet another attempt at trying to find, addressing the root cause and trying to find a better solution to what has not worked well in the past.
But Anna McConnell, the executive director of Maine Access Points, which has led the needle exchange program in Sanford, argues stopping the program, even temporarily, isn't the solution.
I think if anything, it's going to make things a lot worse.
McConnell says the program has seen success. During the last year, Maine Access Points has given out 346,000 syringes and collected more than 372,000.
We have been a place where people can come and access sterile supplies.
The pause comes as the state reports an increase in HIV cases in nearby Cumberland County and follows an outbreak in Penobscot County. In a statement, the Maine CDC says syringe service programs provide a crucial public health service by preventing transmission of infectious diseases such as HIV and viral hepatitis.
I'm very, very concerned that we will see an increase in HIV and hepatitis C in Sanford during this period of time.
City Manager Buck has this to say about her concern.
So the area that is the most prevalent in has multiple syringe service programs.
Despite the one-year pause on the syringe program, Maine Access Point says it will continue to provide other services across the city, including overdose prevention education and HIV testing. In Sanford, Alex Haskell, News Center, Maine.
McConnell says her organization, Maine Access Points, offered to pay for and install containers to reduce needle waste. The city manager says he's concerned about the message those containers might send. He says after 1 year, the city will review the results of the pause and figure out next steps.